If you're at a high level of psychological distress, if you're at risk of suicide, if you have that suicidal ideation and whatnot, that reach out to Lifeline straight away, reach out to 000, get that emergency support immediately.
Why the generation, especially the younger generation, is getting getting affected with mental health?
Sort of the expectations that are put on young people these days, and a lot of the things that they face at school, the bullying, the challenges and whatnot it's a never-ending comparison of themselves to others, social media specifically for that.
And what is the age group that is predominantly get affected?
It's getting younger and younger. So I'm talking like under 12 years old. Kids are starting to present with it as young as 8, as young as 10 years old.
What are the statistics?
Say probably 80% they know or they are someone who suffers from a mental illness.
Is it an illness?
It's treatable, so it is. Yeah, absolutely. So.
Hey guys, welcome to Studio 9. In today's podcast, we have someone who has been in a space where he's very specializes in mental health, also drug addiction and alcohol addiction. We're going to talk ins and outs and his experience with dealing with these issues and understanding how deeper this is and in general and understanding this space. I just want to let the viewers know that it can be, there's a discretionary warning that we want to make sure that it is not for everybody. So if you don't feel comfortable while watching this podcast, we just make sure talk to somebody and consult somebody before you watch the full podcast. So stay tuned. We got a lot of interesting topics that we're going to discuss in today's podcast. Dean Nixon, welcome to the podcast.
Thanks, Denton, mate. Appreciate you having me along. Really excited for it.
Being in this space and off camera before the podcast, we discussed a lot of things. Tell us about your journey, how you started in this space, and just quick insight.
Yeah, absolutely. Yeah, I begun a lot of my career in sales and marketing and a lot of different roles like that. Have run my own businesses and whatnot in the past. And it wasn't until an opportunity came up with a local organisation in a role that was mental health focused, but actually had a lot of marketing and business related to it as well. It was a community outreach role, and sort of raising awareness, running social media pages, things like that, that really went, hey, I could probably jump in and do that because of the experience that I had. Mental health and addiction support and things like that, it's always something that's been pretty close to home with a lot of personal life, a lot of experience, as a lot of people do have someone in their life or people in their life that have been affected by it. And yeah, when I saw this opportunity to jump in and do a role that sort of makes more of a difference, it was something I wanted to do. So I made the leap. I jumped across, and I don't think I could ever go back to working retail again after that because it's a much more rewarding career, and it was really just seeing the difference being made and a lot more focus and attention on mental health. As we know, it's something that I love to see, and I'm very excited to work in this space and to make a difference in our community as best I can. So, yeah.
I think anybody who works in this space in regards to mental health, youth, alcohol, drug, I think it's significantly important. I think the cause itself is so big, especially with the younger generation, kids, older generation, and on, the data suggests, the numbers, when you look at it. We had a discussion with a doctor here based in Harvey Bay. He also said it is a very significant issue right now, and everybody's focus is towards that, and especially towards the younger generation. So tell us what does it lead to? Why the generation, especially the younger generation, is getting affected with mental health?
There's a lot of contributing factors to it, and I'll preface by saying I don't have a clinical background, but I've been in this space for such a long time, and really gained a big awareness as to specifically youth-focused why they get the presentations they do with mental health, and a lot of it stems back to just sort of the expectations that are put on young people these days, and a lot of the things that they face at school, the bullying, the challenges and whatnot, that in the past, once you left the school grounds, you escaped it, you got home, you didn't have a lot of technology to keep you hyper connected and whatnot, that's following them home now. They're coming home and they're getting the same treatment that they receive in the schoolyard. They're getting the same bullying, the same problems, and there's just a never-ending cycle of it, and it's a lot of things that probably would have been considered mental health issues or mental health challenges that the older generation have faced. It just wasn't diagnosed or not aware of back in the day, and that's flowed on through generations to their kids. And it's a factor of that they're facing a lot more trauma and a lot more challenges than ever before, but also we're a lot more aware that it exists. So we're seeing the diagnoses more often. We're seeing a lot more people talking about it, which is a great thing because it means more people are getting support. But it's just that fact of, it's a never-ending comparison of themselves to others, social media specifically for that, where you're only seeing the highlights of people's life on social media. They're not showing the lowlights, and young people are going in and saying, that's what I need to aspire to be, and that's where I should be. And they're not really giving themselves the patience or the knowledge of, this isn't realistic. The expectations are too high. Yeah.
So when you say the space, so what is the age group that is predominantly get affected, and when you start seeing that, okay, this is the age group where you have to start monitoring the kids, or so?
It's getting younger and younger. We're seeing in my previous line of work a lot of younger people that we weren't actually funded to see presenting and trying to be referred in when we couldn't support them, and there wasn't a lot of options in the community to support them. So I'm talking like under 12 years old. Kids are starting to present with it as young as 8, as young as 10 years old. Just those early signs of anxiety, depression are the big ones, of course. But it can come on in different ages. I'd say the most higher, like the higher levels of psychological distress and whatnot, sort of that 16 to 24 age group. We used to see a lot of those guys presenting with the harder issues that they needed a lot more long-term support with. Whereas the younger age groups, they might have just needed a lot more support around school and handling the anxiety and the stress of school, and bullying relationships is a big one. Things like eating disorders and whatnot too, but definitely that 16 to 24 age group were when it started to peak, as these are the higher levels of distress, and they probably should have seen support prior to this level of presentation, basically.
So if someone is going through a bit of a depression, anxiety in the early ages, and they don't get fixed, or you don't see or do a counseling, pretty much as you grow up by the age of 16 to 24, it's where it hits its peak.
Yes, yeah, absolutely. And it's of course it's different for different people, but the data suggests that that's sort of the age group that you're looking at. We know that 16 to 24 year olds, they present with about 30% of those young people have had a psychological illness that's lasted more than a year, so a long-term presentation. And when you actually spread that over the higher age group, it's about 20%. So that younger age group now coming through are seeing a lot more psychological distress over long periods of time, and that's because it can be stemmed because they weren't intervened earlier, so they weren't getting the support they needed, or they weren't getting they weren't reaching out for support when they probably should have been.
Is it too hard to reach out for support, or okay? Let's before that. What kind of is it male? Is it more females, or what gender are we looking here?
It's spread quite across both genders, or all genders, and essentially what we're looking at is young females are more likely to reach out for support. They're more likely to come forward and say that they are facing issues and that they're having challenges. And especially the LGBTQ community, they reach out for support a lot more. They show a higher level of psychological distress. But young males actually have the higher prevalence of suicide. Men in general in Australia, I believe, have 75% of the suicide rate. So they're more likely to get to that level where they're beyond support or gone too far before reaching out. So definitely, I think the stigma breaking is working really well with young females and that community, where they're actually talking about it more, getting support more, whereas young men still somewhere that I think we're in the infancy stages of breaking that stigma of it's okay not to be okay, it's okay to reach out for support, and there's a lot of good orgs in the region specifically targeting young men, and for good reason. Yeah.
So when you say that it's men who not able to reach, is it because a lot of men have a tendency to say that we are tough, we don't really have to discuss these issues?
Yeah,
so
absolutely.
So, and is the thing that, do you think that a lot of stuff needs to come from parents, especially when you're home, you see your kid be open about it and start talking, hey, are you okay?
Yeah, it's definitely that generational of, you're told to toughen up, told to suck it up, told to keep your problems to yourself. And it's just the society's expectation of men that you have to have this strong, you have to be the protector, you have to be the, the person who looks after the family and who never needs help. And I'm sure a lot of men listening to this podcast would feel that expectation on them to always be perfect and always be the person that's looking after everyone else before yourself. And I think the message is coming out a lot more now for men to prioritise mental health. We're seeing, like, the last few years of statistics have seen a higher prevalence of men actually reaching out for support than ever before, which is great. And a lot of good reason for that is, celebrities and a lot of male athletes and things like that have really advocated for mental health. We see it in sports. We see, the NRL, AFL, they push a lot of mental health promotion and whatnot in their sports broadcasts and whatnot. So it's definitely come to that level where it's expanding and a lot more people are being made aware of it, but it's still that community that really need to just break that stigma.
So mental health and then alcohol addiction and drug addiction, they all pretty much correlated.
Yeah, so a lot of what you'll see is that a lot of people who suffer from addiction-related problems, whether it's prescription painkillers, whether it's high marijuana use or illicit drug use, it is a prevalence of other mental health issues as well. Not necessarily the other way around, like people presenting with mental health issues might not always have an alcohol and other drug addiction issue, but definitely in the case where they're presenting with an addiction issue, normally there's an underlying reason for that. And so a lot of the times you'll see orgs in town where you'll be prioritised to go get that addiction problem sorted out before you'll be able to be seen by mental health support. And that's one of the challenges that the region really faces in terms of the system's very hard to navigate, and we know that. And a lot of the orgs in this region that are working on bettering pathways and whatnot are making changes and trying to address that issue. But it's just, it's a very difficult system, and the feedback from stakeholders is that it's a very difficult system to navigate, and that we want to see a lot more progression where people are walking into one door and getting all the help and support that they need. And that's definitely the pathway that we're on in the Wide Bay, for sure.
So if someone's watching and someone is very hesitant to approach, what is the process? So what do you do? What's the first step that they should take?
It's definitely very dependent on what issues you're facing, but definitely if someone wants support and wants help, then the first thing to do is talk to the person you're most comfortable with. Talk to family, talk to your GP if that's the case, talk to someone who will listen to you actively and be able to actually give you the guidance and support that you may need to reach out for professional help if that's the way you need to go. Definitely, like a lot of people, it's that first reach out that's the hardest thing, and that's why you see Are You OK Day and things like that pushed so hard, where we're trying to get that message across that people can reach out and ask the question of if someone's okay and actually listen to them and not just pass it off as a fleeting message. So, definitely talk to someone you're more comfortable with. And if the need is there for mental health support, know that we have this stigma in our brain a lot where we see counselling as what we see in movies, right? Where you're laying on a bed, on a couch, and someone's over you with a notepad and taking notes and you're feeling judged and you're feeling critiqued. And it is not like that. I can tell you the young people that walked into the service that I used to work in, they'd be sitting there playing playing cards, might be over video games, and they don't even realise that they're getting therapy from the person providing it until after the session. It's a matter of they are having a space where they can be distracted by something and they don't even realise their mouth's going and that they're talking. So it's a safe space. It's somewhere where you're not going to be just put in a chair and judged and put on a harsh critique. You're going to be listened to in a way that you're comfortable and that you're not even thinking that you're doing it. Yeah.
So let's come to White Bay. How serious is this issue? When you say number-wise, is it in this younger generation and everything? What are the statistics?
The statistics is an interesting one. I think what you're looking at is that the majority of young people in our schools, and I'd go as high to say probably 80%, they know or they are someone who suffers from a mental illness. They very much have an idea of what mental illness is. They have an idea of what anxiety is, what depression is, and yeah, definitely it is talked about a lot more in schools. A lot more people are aware of it, and a lot more people are facing the issues now or aware of them and reaching out for support now. When you're talking about like how many people are being seen in our community for mental health, it's nowhere near the number that should be. You definitely, there's a lot of people out there that aren't reaching out for the support that they need. But you can see it in the services that are here, how backed up they are. A lot of them, it's 6-8 week wait list to even get in for that first counselling appointment. And that's difficult. That's hard. That's for a young person specifically who might be reaching out for support. That 6 weeks might change drastically. You might go from being in the middle of a school term to then when you're asked to come in for support, it's school holidays and you're happy, you're home, you're living your life. Why would I go in and, walk into a counselling environment? So it's a system that's clogged up, and we definitely, the community is working really hard to make sure that it's speeding up, and it's no problem by the organisations. They're doing the best they can, but it's just such a big business now. It's such a big problem for Australia that Wide Bay specifically as well, where we see a higher prevalence of people with low socioeconomic status. So compared to the rest of the state, so we see people who can't afford to pay for psychological support or pay for services. So we need these bulk billed government funded services to pick up and get the funding they need to be able to provide the support to that lower socioeconomic graphic. Yeah.
Do you think because the reason it's so clogged up is because are we regional? Is that why? Or is it a funding issue? Or is it we don't get qualified people to get these services done?
It's a multitude of things. I wouldn't necessarily say it's a funding issue, but I'd say definitely you see the stats show that regional and remote communities and rural communities see a high prevalence of mental health and mental issues. And you also see that young professionals that might be studying in the mental health space and want to enter the mental health space, they're not staying here. Young professionals, and it's across the board, it's not just for mental health, but young professionals are leaving the Fraser Coast at rapid rates. We have a very, very ageing population. And there's a lot of people, a lot of studies out there as to why that is happening to a lot of regional communities. But Fraser Coast specifically, from a young person's point of view and a young professional's point of view, there needs to be more here for young people to do after school. We don't offer enough in terms of tertiary education and TAFE and university where they're actually getting degrees that they want to stay here and study here. People aren't moving here to study at our universities there. And because of the increase of online universities as well, people are just studying from home or moving away and being able to study as well. But also just the entertainment wise, I don't think, it's not a critique of Fraser Coast Regional Council, but I don't think we've prioritised getting entertainment here, getting the facilities and the stadiums and the things that we'd love to see come to the Fraser Coast, where we'll actually get entertainment here for young people to lead a fulfilling life on the Fraser Coast.
So you say like if the council of the region does more for younger generation, like having activities, sports, stadiums, or to keep those younger generation closer to their families and everything, that means we're doing something better towards this bigger problem.
Yeah. Yeah, absolutely. The younger generation coming through are going to be the most educated generation that we've ever seen, in terms of the amount of support they're receiving in school. Relating to mental health specifically, the amount of support they're receiving in school and education around mental health they're seeing, and then the amount of study pathways out of it in TAFE and university is bigger than it's ever been. It's a growing workforce, and it's a young workforce. A lot of the people that I've worked alongside in my last few roles in mental health have been younger, have been, freshly out of school or out of university, to the point where the gap in the workforce is so short that organisations are hiring people that are midway through their degree, and with the promise that they're going to finish their degree while they work there. So you have people who are going into counselling and whatnot environments that only halfway through their study because we need young people in these roles. And it's absolutely, if the local council and in general this region works on building out the entertainment value for young people to stay here, and the economic value for them to invest here and build a life for themselves here, we're going to get more people in that workforce, and in the workforce in general that want to stay here at this age.
What is the most common thing that you hear when someone approaches you, because you've been in this field? What is the most common thing that you hear from a male and a female? Like, why they're getting affected, or why they're having this anxiety?
I think the most common thing that I have seen in a lot of my community-facing roles is it's the mums, the dads, the grandparents saying, "I just don't know what to do with them. Like, I don't know what to do with these young people. I don't know what's going on. I don't know why they're lashing out how they are. I don't know how they're reacting." And they're essentially coming at their time of crisis rather than being preventative. So a lot of them are waiting till it's too late to reach out for support, rather than being proactive and at the early signs starting to get those intervention things in place.
So you're saying, like, so there's a child. You see behavior at home. Mm-hmm. And as a parent, you should sit down, have a discussion, and be more reachable to them to say, talk to me if there's any issues or anything. Is that what you're trying to do?
That's absolutely true, but also you also find that a lot of young people that might be facing these issues actually don't want to speak to mum and dad about it, because it's that authoritarian thing where they think they're going to be in trouble for speaking their mind, or they think they're going to be in trouble. And again, there's a lot of reasons for that, and it's not necessarily any fault of the parent. It's just how society is set up, where it's actually probably going to be easier for them to talk to someone who they necessarily won't see again after they finish their counselling, or won't see again after they finish this youth support, whatever the case may be. So yeah, absolutely, you should set the precedent that you're reachable, you're available, you're approachable, and we talk openly in our households about mum and dad face these issues too. We struggle, we have anxiety at work. Be open about it. Be open about what you're facing as struggles in your life. Don't always put on the tough face to your kids, because they're going to face the same thing later on. And if their precedent is that you hide it, they're going to hide it. And it's a difficult thing to do. And I think the way we throw it around of, it's okay not to be okay, it doesn't necessarily set the standard that it is a hard thing to reach out. It's not a hard thing to start the conversation of, "Hey mate, are you doing okay? What's going on? How's life been?" That's not necessarily a hard thing to do. It's something that everyone should be doing, should always be checking in with their friends. But it's a hard thing to breach that level of openness where they're open to talking about it. And a lot of the cases, and it's actually a lot of the changing in Are You OK Days messaging now, is that it might not be the first time you ask someone, "Are you okay?" that they then reach out for support. It might be the 70th time. So the other 69 times are going to be them saying, "Yeah, mate, I'm good. Like, no stress." And then it will be that 70th time where they go, "Actually, things are happening." So it's that same thing you'd see in sales, as people are on a roller coaster of when they're going to actually buy in, and at the point of where they're ready to buy in, you have to be there. So you have to be ever present, ever available, always, being an option to be able to be spoken to, and when they're ready to talk, you're available. basically all addictive substances in those ways, even down to nicotine. It's an increase on mood. So if you're already in a down and sad state, it might create a numbness. It might make you feel like your problems are melting away, but in reality, it's increasing that anxiety and that depression and those things you might be feeling tenfold in the background. So it's something that I think it's quite common in the drinking culture that Australia is, that go out on a piss up with your mates on Friday night and you'll feel great after it. And I'm not saying that those social outings are a bad thing. Definitely social outings are what we're pushing for more, and you're seeing a lot more programs in towns where it's go out and have a drink with your mate, and that's how you start the conversation. But when you're talking about excessive use and you're talking about specifically narcotics and whatnot, it's definitely a mood increaser. So if you're already in that depressed state, it's just going to make things 10 times worse. We know that in the Fraser Coast, a culturally and linguistically diverse community that aren't necessarily first language speaking English, they don't reach out for support anywhere near the amount of natural English speakers that do. But they also have a higher prevalence of mental health conditions. So there's a lot that you can attribute in the Fraser Coast specifically as to why those young people aren't reaching out for support. It can be, the background of where they've come from, that it's not acceptable to speak about issues, or it's not acceptable to show weakness, or whatever the case may be. Or it could be that a lot of the people from those backgrounds in our community have highly successful parents or highly successful, siblings and whatnot around them, that they might be getting more private support rather than the bulk billed or funded support. So it's just that the actual bulk billed Australian support system isn't seeing them come through. They're seeing the private system. But the reality of it is that community is insanely underserved. Any culturally and linguistically diverse, especially if they come from a refugee immigrant background, they have a high level of trauma that creeps into life later on and might be passed down to future generations and whatnot, where they need support more than ever. And a lot of orgs aren't catering for that in terms of, I know a lot of local orgs actually do have translator services. That's one thing, but actually being able to speak to someone in your native language in a counselling environment, it just shows how we need this community of professionals to grow, and we need people from different ethnic backgrounds to want to work in this industry. Yeah.
I'll give you a very clear example. Me being an Indian, we grown up as a kid, every time there's an issue or anything, pretty much that's what we've been told. Toughen up, keep moving forward, mate. You're good. And as a male, it's a very thing that, as you said in the beginning, that it's our job role in a family to make sure we lead the family. The issues are issues. You deal with it, keep moving. But as a father or as a brother, I think we take care of everybody around us, but we forget to take care of ourselves. And that's where I think the big problem with men being men is now we're not open, because we think, who's gonna say? What they're going to think about. I think I should be the role model in the family. So is it an illness?
It's treatable. So it is. Yeah, absolutely. So all mental health conditions, or they're considered conditions, or they're considered illnesses, they're considered problems. All those things are fixable, right? Problems, conditions, illnesses, they're all curable, they're all fixable. So it's absolutely something. Actually, I probably won't use the word curable. It's manageable is what it would be. So there's things that you can put into your life and practices that you can put in place to help ease the effects of it. So it might not necessarily ever go away. You might live with it for the rest of your life. But you've put management things in place where when it comes on, or when those conditions come on, or when you're feeling at your worst, you know what to do to pull yourself out of it, or you know what to do or who to reach out to get the support that you need. I know a lot of people who have seen professional help for years, and they still have those big episodes where it feels like there's no coming back from it. I know a lot of people who have let anxiety really impact their life, to no fault of their own, of course. I'm never going to blame them, but it's something that even you hear a lot of people saying, I tried counselling once, didn't like it, it wasn't for me, I'll step away, and they'll never touch it again. We talk about counselling now as dating. They might not be the right counsellor for you. You need to connect with them on a rapport level as well. So if you're going in there and you've tried it, and I'll implore anyone listening to this podcast, if you've tried counselling or therapy before and you hated it, try again and keep going till you find that right person, because it's the same thing as the dating market. You need to find that right person to understand you, understand your specific conditions, sit down with you and really make that connection. And there's great counsellors out there. I've worked with some astounding people who I think everyone could learn something from, and it's just about finding them.
How expensive it gets for someone to go in, especially in Australia, where is it all funded with Medicare, or it has to be personal or private insurance? How does it work?
So it sort of depends on the level of support you are receiving, but essentially the Australian government definitely wants all levels of psychological distress and all levels of mental health conditions to be treatable by the public I can't even speak. Sorry, mate. The Australian government definitely wants all levels of psychological distress to be able to be treated by the public system. So they are funding programs from all levels of brief intervention all the way up to psychological support. The matter is the wait time on it. So you see the publicly funded psychologists, some of them don't have their books open for 2 years.
2 years is the wait time.
For some, yeah. There's some that, you could get in 3 months, 6, and it's all varied on severity as well of what you're going through. Like, of course, if you're flagged as a high risk, that they might prioritise and get you in quicker. But that public system is prone to blockages and prone to backup because of how in demand mental health is at the moment. And not at the moment, it always will be now. But essentially, the public health system, it's fully accessible, but it's just a matter of time frames, and that's what the government's working really hard to do. And what a lot of the funding is about increasing those pathways and making more options and making it easier to assess, and making a lot of virtual and like online therapy options, so you can access professionals from the comfort of your own home as well.
So I know that you can't talk numbers or anything, but do you know on an estimate what kind of funding the government throws in?
The government throws a lot of funding at mental health, for good reason. It's a lot of it's actually increasing to Headspace services, which is the young people 12 to 25. Headspace do incredible work across Australia. They're an amazing organisation, and I think that is incredibly justified, that the brief intervention and the early intervention model is what they're funding really heavily, because as we've talked about in this podcast already, that early intervention is so essential to making sure that the conditions don't develop into needing that psychological intervention later on. So if you can fund this model of a lot of people are being seen at the early stages before they develop higher conditions, it's going to decrease that workload on the higher psychological distress and make the whole system flow a lot quicker. So I can't remember the number specifically, but I know that a lot of money is thrown at mental health. It doesn't necessarily stem to like alcohol and other drug addiction services. They're quite a unique one, where a lot of the funding that's thrown to mental health only makes it to mental health services. I'd love to see an increase to a lot of addiction and alcohol. As I've said, a lot of the mental health services won't actually see a person until they've been seen for their addiction, if that's an underlying cause. So you're talking about, a service might get 30 referrals, 20 of them have addiction as an underlying cause, so they'll push those 20 across to an AOD management service, and they'll be backed up for months. Alcohol and other drugs. Yeah. So it's a matter of those communities go hand in hand, and we're seeing a lot of changes where funding's being done in tandem, where it's a mental health and an AOD support service in one, and also that there's a lot more agreements between alcohol and other drug services and mental health services, because, as we've said, it goes hand in hand.
So most of this sector is completely public, or there are private sectors also doing it like there?
There's a lot of private. Yeah, there's a lot of private providers out there, whether it's psychology, whether it's mental health social workers, even down to dietitians and whatnot, because a lot of eating habits, eating disorders is such a big thing as well, where dietitians are even brought into that mental health space too. But there's a lot of private providers out there, and a lot of the time, they can be a bit quicker to get into, but you're paying for it. And when you're talking about, as I've said, the rural and remote communities are the, lower underprivileged sort of areas, the people that need the support most and have the most traumas in their life and aren't necessarily getting the enrichment that they need from family and people around them, they can't afford to get that support, so they're stuck in that wait list of, as I've said, 2 years for psychology or 6 to 8 weeks for basic intervention. So yeah.
So you know that there is so many programs going on right now. Is it actually helping?
Absolutely. We're seeing a massive uptick in the amount of people actually reaching out for support, which is huge. And we're seeing a lot of those groups that we've identified that have a high prevalence of mental health disorders, whether it's the LGBT community, young men, culturally and linguistically diverse, and Aboriginal and Torres Strait Islander people. A lot of the orgs, that's their 4 core streams of where they would like to increase how they are servicing that community and how much support those communities see. And they're increasing year on year on how many people are reaching out for support. And it's something that I think it's talked about a lot more. As I've said, a lot of celebrities are talking about it a lot more. A lot of athletes, a lot of musicians, a lot of singers. Everyone is talking about mental health. It's kind of the buzzword a lot, where people might be throwing it around too much and using it quite tokenistically to gain favour. But it's something that I think the more communication about it, the better.
Mm-hmm. So anyone who's watching this and you've been in this space for so long, what they should do to reach out? Any special programs that in Harvey Bay, in White Bay, that they can reach out and say, hey, reach out to these programs if you're really struggling, and it is anonymous, you don't have to disclose your names or anything. What programs are currently running?
I'll definitely preface by saying if you're at a high level of psychological distress, if you're at risk of suicide, if you have that suicidal ideation and whatnot, that reach out to Lifeline straight away, reach out to 000, get that emergency support immediately if you're at that level. But if you're talking getting in to see counselling and general addiction support, things like that, there's a lot of great orgs in our region who are already working in that space. Young people, as I've said, Headspace, 12 to 25 years they service. That's where I'd recommend if you have a young person that you think could reach out for support. You can also, if you're having trouble navigating the system and getting into the system, see your GP, talk with them, your local general practitioner, and they can create a mental health care plan for you as well. And that can get you into a lot of private organisations for 6 free sessions from funded by the government as well. So it depends on what avenue you want to go into. There's a lot of good addiction management support in our region as well. One really good resource I would recommend everyone to look up on their phone, save to their phone, is the council have made the Little Library, they call it here. So if you look up the Little Library Fraser Coast, it's a website on there where it actually has all of the organisations in town that work in the social services industry, all bookmarked with what they do. And you can just search, say, youth addiction, and it will come up with all the orgs that service that industry here. And you could look up, Aboriginal and Torres Strait Islander health, and it will come up with all the orgs here that specifically cater to Aboriginal and Torres Strait Islander health as well. So, that's littlelibrary.org.
So, even let's say you go to your GP, the GP prescribes you, and you do a lot of things, but it's also to a person needs to take initiative and start caring for himself more. Mm-hmm. And doing things so that it helps him. Yeah. So I think it comes also, you have to take the first step, or you're not going to help yourself, pretty much. So
a lot of the early messaging in in brief intervention and in that early support, those first counselling sessions that you might do with the clinician, a lot of it is around identifying the things in your life that make you happy and the things that are your triggers. And so identifying what you can do to increase your mood and what you can avoid to make sure your mood doesn't decrease. So anyone can do that. Anyone can sit down and go, I know that when I go and have KFC on a Friday, on Saturday I'll wake up feeling like crap and and I don't feel good about myself. And I also know if I go for a walk on the beach at afternoon and watch that beautiful sunset that we get in Harvey Bay, that I feel incredible. So anyone can identify these things and lay out what they would like to do. And that's, again, what a lot of the early sessions are in counselling. And what I'd recommend anyone to do.
Okay, so anybody who's watching this podcast, and if you watched right till the end here, it is so important, as Dean has mentioned, it is so important to reach out. You're the only person who can take that first step. You have to take the first step, and there are resources, there's people, and we've been so fortunate to in a country and a place that we live in that there is so much resources it's available today. So do reach out if you're watching this podcast, and I would highly recommend, I think there are, as said, if you are under 16 to 25, it has 12 to 25, Headspace is one of the best ones. I think I've seen them in a lot of places, and I think it's a great place to be. And Dean, thanks for sharing your insight. I think it was amazing. I think it's a topic that you can dive in for the whole day and it will never finish. Mm-hmm. I think we'll leave this segment here, and probably we will catch up sometime later and in coming months and see how is there more insight that we can discuss, and if we have any comments from the audience saying that, hey, we need to talk more about this, then we can bring you on to the podcast. Thanks, Dean. It was wonderful for you to be on the podcast here, and thank you for coming.
Thanks, mate. Appreciate it again.